Welcome back. With a growing awareness about emotional trauma and its long-term effects on health outcomes, both for soldiers and everyday civilians, a new treatment is making news for the dramatic ways that it's been helping people face PTSD. JORDANNA Saunders, CEO and EMDR therapist, and JANICE TALAS-DENNY, practice manager from Trauma Recovery, are both here to tell us more. Welcome. Let's start with the basics. What is EMDR? What does that stand for, and what is it?
It stands for eye movement desensitization and reprocessing. It's just a fancy way of saying that, it resolves trauma. There's a process, there's 8 phases, and now they call it EMDR therapy. So it's an evidence-based type of therapy that is used, as you mentioned, for PTSD, but also for depression, anxiety, car accidents. I mean, the gamut of things that can happen out in the world.
So can you explain how it works? Because I know there are a few different methods. I've actually tried this once, and there was like a therapist kind of like, I was looking back and forth between her hands, but I know sometimes people use like a little machine. How does it actually go down?
Yeah, so you're describing a component of EMDR. So one of the phases is called reprocessing, and so we use bilateral stimulation. And so, like you said, there's a variety of that. There can be either where you're watching, usually it's a light bar, there's a light that goes across and you watch it go back and forth, or all of us are trained to use our fingers, so there's mechanics.
That's what I had, right?
Yeah.
So what's happening in my brain when I'm looking back and forth following a therapist's fingers?
So what's happening is you're accessing that memory, that state, that emotion, whatever it was that got stored at the time of that maladaptive event. So whatever that trauma was. And what we're doing is we're reprocessing it, because when that trauma occurs, it gets trapped in that original state. So if you were 5 years old and you got bit by a dog, you may be 30 now and you're still afraid of dogs, but the memory is stored in that 5-year-old version. So what we're doing is we're accessing it, we're reprocessing it, so we're giving it access to current day resources, and we're also repairing to some degree what has occurred. So we're making it a neutral situation instead of a charged one, where every time you see a dog, you're afraid. Now you see a dog and you remember, I got bit by a dog, but it doesn't have that same charge. You're not like, I got to get away. But the bilateral stimulation, that's what it's doing, is it's bringing up that memory in the part of the brain where it's stored intrinsically. So it's stored with the memory, the sensations, and the feelings, but it's not adaptive, which means it doesn't have current day resources. It can't just go back, and you can't go and say to your 5-year-old self, hey, I'm okay now.
It's over. That dog's not biting you, because when your mind relives it, it still produces stress hormones in your body, even though that might have happened when you were 5, which actually brings up a question that I have, and maybe Janice, you can speak to this. Does this EMDR have to be proximal to the event? In other words, can I work on something that happened at 5, or does it have to be like you've got to get there within a month of some traumatic incident?
No, absolutely. You can work with something that happened from childhood, a childhood trauma. As we age, that length of time that passes, it's going to probably take a little longer, for you to feel better, to stop having that anxious feeling when you had that trauma. You feel that anxiety, you're afraid, or whatever feelings you have due to that trauma. It's going to take a little while longer to heal, as opposed to a younger person. We do treat teenagers, so a younger person would benefit from EMDR a lot quicker than, say, you and I would.
That's great to know. We only have 1 minute left. What are some types of people and traumas that might benefit from seeking out EMDR?
So the example we gave is a good one, right? It's everyday things, car accidents, injuries, bullying is really common, right?
Wow.
People experience that, and we know that is a pervasive event that can lead you to stressors later in adulthood. Sexual assault, sexual abuse, domestic violence, anything that is PTSD related, stress, depression, anxiety, so all of it, sleep issues.
Thank you so much, JORDANNA, Janice. It's a lot to think about, and help is out there. You can find it. It's all around.